ഹലോ ഫ്രണ്ട്സ്, പുതിയൊരു വീഡിയോയിലേക്ക് എല്ലാവർക്കും സ്വാഗതം. 1000 MCQ സീരീസിൻ്റെ പാർട്ട് 40 വീഡിയോ ആണിത്. അപ്പോൾ വീഡിയോയിലേക്ക് കടക്കാം. ഫസ്റ്റ് ക്വസ്റ്റ്യൻ, പ്ലാസ്റ്റർ ഓഫ് പാരീസ് ഈസ് ദ മോസ്റ്റ് കോമൺലി യൂസ്ഡ് മെറ്റീരിയൽ ഫോർ ഇമ്മൊബിലൈസേഷൻ ഓഫ് ഫ്രാക്ചേഴ്സ്. കെമിക്കലി ദ പ്ലാസ്റ്റർ ഓഫ് പാരീസ് ഈസ്, ദ ഓപ്ഷൻസ് ആർ കാൽഷ്യം കാർബണേറ്റ്, കാൽഷ്യം സൾഫേറ്റ്, കാൽഷ്യം ഹൈഡ്രോക്സൈഡ് ആൻഡ് കാൽഷ്യം ഫോസ്ഫേറ്റ്. And the answer is calcium sulfate. The next question, most common cause of pyoderma in neonates is, the options are Candida albicans, Staphylococcus aureus, E. coli and Chlamydia trachomatis. And the answer is Staphylococcus aureus. Pyoderma is an infectious pustular eruption, mainly seen in neonates. And the next question, at which age a baby can start to sit without support? The options are 6 months, 8 months, 10 months and 12 months. And the answer is 8 months. Next question, causative organism of yellow fever is, the options are myxovirus, enterovirus, arbovirus and rhabdovirus. And the answer is arbovirus. The next question, Imferon is the drug of choice for, the options are dimorphic anemia, megaloblastic anemia, pernicious anemia and iron deficiency anemia. And the answer is iron deficiency anemia. Next question, the group of drug that increase catecholamine level in brain. The options are antiemetics, antidepressants, antimanic and all of the above. And the answer is antidepressants. The next question, in following, which is the commonest psychiatric symptom? The options are hallucination, anxiety, apathy and depression. And the answer is anxiety. The next question, examples of combined vaccines are except, the options are DPT, BCG, DT and MMR. And the answer is BCG. Remaining options are combined vaccines. The next question, Haemophillia appears in, the options are only male, only female, by both and none of the above. And the answer is only male. The male inherit an X chromosome from the mother and Y chromosome from the father. This means the haemophilia almost always occur in boys and is passed from mother to son through one of the mother's gene. In the next question, oral monoliasis is mainly the infection of, the options are bacteria, virus, fungus and protozoa. And the answer is fungus. Oral thrushന്റെ മറ്റൊരു പേരാണ് oral monoliasis. It is an infection in which the fungus Candida albicans accumulates in the mouth. Next question, the voluntary health agency whose main objective is to improve the condition of women is, the options are Red Cross Society, Kasturba Gandhi Memorial Fund, TB Association and BSS. And the answer is Kasturba Memorial Fund. The next question, DMPA and NETEN prevent pregnancy by, the options are suppressing ovulation, suppressing spermatogenesis, interfering with the implantation of the fertilized ovum and preventing deposition of sperms into vagina. ഇത് രണ്ടും injectable contraceptive ആണ്. And the answer is suppressing ovulation. The next question, the affect most commonly found in client with schizophrenia is one of. The options are happiness and elation, apathy and flatness, sadness and depressed, anger and hostility. And the answer is apathy and flatness. The next question, frozen DPT vaccine should be. The options are allowed to melt before use, shaken thoroughly before use, brought to room temperature before use, and discarded. And the answer is discarded. Frozen DPT should be discarded. The next question, which IUCD need to be replaced only after 10 years? And the options are copper T 200B, Progestasert, copper T 380A, and Nova T. And the answer is copper T 380A. The next question, disorders characterized by physical symptoms resulting from psychological factors. The options are somatopsychic disorder, schizophrenia, psychosomatic disorders, and phobic disorder. And the answer is psychosomatic disorders. The next question, which of the following cause winging of scapula? The options are paralysis of supraspinatus, paralysis of infraspinatus, paralysis of serratus posterior, and paralysis of serratus anterior. And the answer is paralysis of serratus anterior. The next question, which of the following manifestation is most significant on second day of fracture femur? The options are hemorrhage, pain, hypertension, and tachypnea. And answer is tachypnea. Tachypnea is the primary sign of fat embolism. The next question, the state of possessing qualities and abilities that are required for a particular role or task is. The options are competence, need, learning, and interest. And the answer is competence. The next question, which of the following method of teaching is based on problem solving approach? The options are nursing process, nursing care study, nursing care conference, and none of the above. And the answer is nursing process. അപ്പോൾ ഇത്രയാണ് ഇന്നത്തെ വീഡിയോ. അപ്പോൾ വീഡിയോ ഇഷ്ടമായെങ്കിൽ ലൈക്ക് ചെയ്യുക, ഷെയർ ചെയ്യുക, സബ്സ്ക്രൈബ് ചെയ്യുക. 1000 MCQ സീരീസ് DME എക്സാമിന് മുന്നേ കംപ്ലീറ്റ് ചെയ്യണമെന്നായിരുന്നു ആഗ്രഹം. അപ്പോൾ എക്സാം നാളെയാണ്, അതിന് മുന്നേ കംപ്ലീറ്റ് ചെയ്യാൻ പറ്റിയില്ല. നല്ല തിരക്കായതുകൊണ്ടാണ് വീഡിയോ ഇടാൻ പറ്റാതിരുന്നത്. അപ്പോൾ താങ്ക് യു ഫോർ വാച്ചിങ്.